hygienic. Right, there we go. I'm ready with my gloves, nice and comfortable. Are you nice and comfortable? Are you nice and comfortable? Yes, okay, excellent, very good. Now then, we're going to begin with listening to your heart, okay? Right, I'm just going to place this on your chest. Over the clothes is fine, you don't need to do anything there. Okay. Just listening to your heartbeat now. Very good. Very strong. Nice steady rhythm. Nice BPM. Okay, that's excellent. Right, next I want to listen to your lungs. Okay, so for this I'm placing the stethoscope in various different places. Okay, here we go, one here. Now I want you to take a big deep breath in for me, please, nice and slowly. So like, hold your breath. Breathe out for me, please. Perfect, perfect. Now, going on a different place, same thing. Deep breath in for me, please. And out. Excellent. One more. Let's do one more again, just to make certain. Different location on the lungs. And now, deep breath in for me. And out. There we go. That's absolutely fantastic. Well done there. Looks like you have very healthy heart and very healthy lungs. So we're off to a brilliant start for today's exam. Now then, the next thing I want to do, I'm going to use a tongue depressor. I'm going to be depressing your tongue with it. It's basically a lollipop stick. It's just a bit medical. You know, that's what we call it in the medical industry. Tongue depressor. Okay, professional, then you wouldn't understand. You're not a professional like me. Okay, now let me get my necessary stuff. Here we go. Okay, got my little light as well. What I want you to do for me, please, I want you to open your mouth nice and wide for me. Excellent. I'm going to put the tongue depressor on your tongue there. There we go. Is that okay? It's not too uncomfortable for you. No, good. Okay, and I'm just going to be observing the inside of your mouth now, okay? Going to be having a little look in there. See what I see. Taking a look at the back of your mouth, your throat. Looking for any excessive redness or swelling. Looking at the health of your gums as well. Let me just see. Okay, that's good. Good coloration. That's fantastic. Have a very brief look at your teeth as well. Just to see if there's any indication close your mouth now. That's okay. Well done there. Did very well indeed. Now, I want to move on to your eyes now. First things first, using my hand, I'm going to cover up one of your eyes, okay? Hope that's okay for you. Now, using the light once again, I'm going to be bringing the light in and out of your field of vision, okay? In and out of your field of vision. In and out. In and out. In, out, in, out, in, out, in, out. Your eyes seem a little bit sensitive today, don't they? Goodness me, they seem to be reacting very strongly to the light. Is it almost overwhelming for you today? That's unusual. That is unusual. How do you feel during this? Let me try the other eye. Are you doing okay? Doing okay, right. Let's have a look at the other eye. Do you feel any dizziness when I'm doing this? No dizziness. Any pain or discomfort? A little bit uncomfortable, is it? It's too bright. Right, I see. Okay, my apologies. I'm not going to be doing it for too much longer, okay? I just need to see how your pupils are reacting. Okay, that is interesting. So, why is it that you came for a neurological exam today? Did something happen to you? You had an accident? Okay. Okay, I see. Perhaps it has affected your vision ever so slightly. We will be careful to make observations with your eyes specifically today. Now, next thing I want you to do, I want you to keep your head nice and still for me, please, nice and straight, and don't move it. Don't move your head, okay? Don't move it. Not like this. Like this. Nice and still. Right? And then use your eyes, your eyeballs, to follow the light as it moves. Only move your eyes though, okay? Does that make sense? Excellent. Now, keep following the light. Keep following the light. It's going to move in different little directions, different little patterns, okay? Different little directions, different little patterns. Keep following it. Keep following it. What about during this? Is this overwhelming and uncomfortable like the last test? Not so much. That's a good sign, so you can easily follow this light now, can't you? Yes, brilliant. Okay, that is good. That is good at least. At least we've got that going for us. Marvellous, marvellous, marvellous. Just a little bit more, okay? I'm going to move it a bit further back. Follow it. Follow the light as it moves. Okay, good. Keep following, keep following. Good stuff. Okay. Okay. I like what I was observing there. I don't think there's any problems there. Now, still, looking straight ahead. This time I want you to focus on my nose, and I don't want you to move your eyes at all, or your head. Just keep nice and still, perfectly stationary, okay? I'm using the light again. I'm just going to be bringing it sort of in and out of your vision, at the very edges of your vision a little bit, okay? And I'm just going to be observing how your eyes respond to this, okay? Okay. Okay, that's it, right? Interesting. eyes are actually doing pretty good. It's just when exposed to light very close, very intensely, there's a little bit of struggling there to focus, to deal with the brightness. Okay, I don't think that's necessarily anything to worry about, just a little bit of photosensitivity that you've had after your recent little bump to the head. Okay, I think that is going to fade with time. Give it a couple of weeks and you will no longer experience that photosensitivity. Okay, 90% sure that's the case. We will do a follow-up on your eyes in the future, soon, next time when I see you. Okay, just to make certain that that is the case and that there isn't anything else that it could indicate. Okay, okay, but so far, good, reasonably good results. Okay, nothing to be concerned about. Let's go and do the next test. Okay, now I'm going to just feel around your face quite quickly. Okay, with just my fingers and my thumbs. What I'm doing here is I'm just applying some pressure to different little areas of your face, different muscles, different nerves, and I'm looking to see how they respond to my touch, to the stimulus, to the stimuli. Okay. And I want you to tell me if you feel any pain or discomfort during this, and also if you feel any sort of weakness, general weakness in the muscles of your face. Okay. Okay, let me just do a little bit of a sweep here. A little bit of a sweep. Okay, how's that feeling? That's feeling good. No problems there. Excellent, brilliant. Okay, now I want to do the sharp or the soft test. Let me get a little brush so we can do this test, okay? Now then, I'm going to use this brush. As you can see, one side is a brush. It's very soft, soft little bristles. The other side, it's kind of hard, okay? We will call it sharp today, even though it's not really sharp, but I'm sure you can tell it's going to feel very different indeed, the one side to the other. Now, I want you to close your eyes. I'm going to touch you on random places on your face with either the soft brush or the sharp end of the handle. Okay, now then, eyes closed. Keep them closed. Okay, keep them closed. Here we go. First little touch. Was that sharp or soft? Good. 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 Sharp or soft? Excellent. Okay, that's very good. Very good indeed. You can open your eyes for me now. Okay, so I'm happy with the nerves on your face. I think everything there is absolutely perfect. Okay, so now we're going to go on and we're going to do a taste test. Okay, quite fun little part of today's examination. I think so anyway. What I'm going to do is I'm going to give you 3 different flavors to identify tastes like, please? Cucumber. Tastes like a cucumber. Correct. Well done. Well identified. Now then, flavor number 2. Let's go for flavor number 2. Right, get your tongue ready. Here we go. A little droplet on there for you. A little droplet of the next flavor. Can you tell me, please, what does that one taste like? Strawberry. Yes, strawberry. Very good, well identified. And the third and the final flavor. Here we go. Right, what is this one going to taste like? Put a little droplet there, a little droplet on your tongue. Okay, very good. What does that one taste like? Cherry. It tastes like a cherry. Yes, brilliant, excellent. Okay, that is all 3 of the different flavors correctly identified. So perfect score there. Next, we have the smell test. Basically exactly the same, but you have to smell 3 different fragrances and identify them for me. Okay, let me just get the bottles for that. Here we go. Okay. Bit stiff, this bottle. Okay, that's strong. That is strong. Could you smell that for me, please? You've had a good smell. Now then. Sorry, I'm struggling with the lid here. Is that good enough? That's good enough. What does that smell like? It smells like a tiramisu. A tiramisu. Correct. That is tiramisu. That is an absolutely delightful dessert. A delightful dessert. One of my favorites. One of my favorites. identified, all 3 smells correctly identified, all 3 flavors correctly identified. Everything is working tip-top in the old olfactory senses there. That's great, that's great. Excellent job there. Now then, what I want you to do, I want you to close your eyes for me. I'm just going to grab a little object and I'll explain what we're going to do next, okay? Now then, with your eyes closed, keep them closed, I'm going to make a number of little click sounds like this. Okay, a number of click sounds, and I want you to tell me the total number that you hear. Okay, here we go. How many was that? 5. Was that 5? Okay, good, good. Next. How many was that? 3. Good. Let's go again. How many was that? 6. Was that right? Okay, good. How many was that? 7. Righto, let's go one last time. How many was that? 7. Right. Excellent. Okay, you can open your eyes now. That was just a very, very quick, rudimentary test of your hearing abilities. Okay, but you know, I'm satisfied that your hearing is working fine today because you've been listening to me the entire time, following my instructions absolutely perfectly, and there's been no issue there. And as we can see from that little test, you can not only identify the number of clicks, you can also identify both on the left and the right side of your head equally. Okay, so that's a good sign. That's a good sign indeed. Now, what I do want to do is I just want to very quickly write down some notes about our findings here today. As I mentioned earlier, everything I think is fine. My only slight concern was the photosensitivity of your eyes when you're exposed to bright light very close to your eye indeed. Okay, so I'm just going to write a few notes and I'm going to send this over as a typed up report to your GP. Okay, and they might ask you to go and have another appointment regarding your eyes specifically, probably in a few weeks, just as a checkup to see if they've improved or not. Okay. That's excellent. That's just for me mostly, so I remember exactly what I want to write and say to your GP later. Okay, so I think that concludes our time together today. That concludes our appointment. You've done very well indeed. As I mentioned, just the one little thing to look up, to check up at a later date, your eyes, the photosensitivity. But I'm pretty confident that's going to resolve itself. Your body's going to heal naturally. Okay, any questions for me today? No questions. Excellent, that's good. Right then, I do believe that's it. Thank you for coming in today. Thank you for doing so well during the appointment, and perhaps I'll see you